Hello everyone. Thank you for joining the webinar on a Saturday night. We'll share the recording as well for further reference for those who aren't able to join or want to refer to it further. My name is Rohit Parak, and I'm from the National Coalition for Natural Farming. Today we are here to discuss the topic on Pesticide Management Bill and focusing specifically on implications for clinical practice, medical fraternity. This is a topic of great importance for medical fraternity, given, according to the National Crime Records Bureau of India, roughly 30,000 people die every year of pesticide usage just from the acute impacts. This doesn't refer to the chronic impacts of pesticides. And we have a pesticide management bill, which is just around the corner. It is supposed to be brought in the parliament uh, later this month or sometime next month in the monsoon session, is what it seems the situation will be. And this webinar is to build an orientation understanding in the medical fraternity to start building that process on pesticide management bill for the medical fraternity. So without any further ado, I would like to invite Dr. Rakesh Chenna, who is a nephrologist and from the network of Doctors Against Paraquat Poisoning. You can feel free to share your comments, questions in the chat. You have been kept on mute, and maybe once we are at at a later stage in the webinar, once the speakers have spoken, then we can get to some discussion if at that time of the night as well, if that is still okay with you. So inviting Dr. Rakesh Chenna. You're on mute, Dr. Rakesh. Yeah, if you could unmute yourself.
Please share my slides.
Cheers.
Where is it?
Yeah. Narasimha garu, these are the slides that you emailed me, right? Uh, Narasimha garu, these are the
Yes, sir.
slides. Yeah,
Same
just
slide.
sharing those.
Good evening, everyone. I'm Dr. Rakesh Chenna, nephrologist and the founding member of DAPP, Doctors Against Paraquat Poisoning, and Vice President. So we are fighting regarding the paraquat poisoning since 3 to 4 years, but cumulatively we formed a society 2 years back. Hello, please change that slide. Hello. Cumulatively, we found the society 4 years back, and recently, since 2 years, actively we are working together. After so many efforts from the all DAPP members, we achieved one temporary success statewide ban in Telangana and also in Andhra Pradesh recently. First of all, I want to thank our DAPP members and also IMA, HRDA, and Telangana Medical Council, policy experts like Narasimha Reddy sir, and legislative members, bureaucrats, and mainly Pesticide Action Network people, because we got so many inputs from there, and Farmers Commission chairman and media, and also Telangana government. And also after banning paraquat in Telangana, after 2 months, Andhra Pradesh government also banned this temporarily. And also we thank to the family members of the affected paraquat poisoning. So DAPP aim is only one aim, that is the prevention of paraquat related deaths. It is only possible by the national wise ban, because even though we got banned in states like Telangana, Andhra, Orissa, and Kerala, but it is temporary, as everybody knows, as per the insecticide network section 27. So our aim is nationalized ban, because one state we are banning, after 2 3 months again they are getting, or other from other state they are getting these paraquat compounds, and so misutilization will be there. So only nationalized ban will give a solution for that. And also public awareness regarding this harmful effect of the pesticides. We are DAPP members, more than 250 members now. We are in their own way, during the practice and during camps. We are enlightening these regarding the side effects of the pesticides, and through the media, through the webinars, like using the gloves and face masks. So many things we are explaining to avoid these pesticides, because many people are using the bottle in water. They are keeping in water bottle and they are keeping in the kitchen. So unknowingly they are drinking. So small precautions, if they will take, we can prevent the major hurdles. So our aim is to ban the paraquat in national waste. And after coming to this, after attending this pesticide action network meeting, and with discussing with the policy expert, not only paraquat, so many pesticides in our society is doing harm. And as discussed by National Crime Records Review, 30,000 people are affected acutely, but lakhs of people are affecting chronically every day by exposing to so many pesticides. Next slide, please. So, our association is advocating these reforms, like the recognition of pesticide poisoning as a major public health issue. We are treating regularly diabetes, hypertension, CKD like that patients, but in the larger view, bird eye view, so we are struggling with so many environmental causes like heat stress, air pollution, heavy metals, and issues with pesticides, and issues with the groundwater problem. We are not concentrating all those things. In all these area, pesticides has a major impact in our day-to-day life, because whatever we are eating, the rice or fruits, everything, it is contaminated with the pesticides. So we are getting any genetic abnormalities, cancers with that. So in long run, it is affecting so much to the society. So we have to keep as a public health consideration regarding pesticides, and also greater consideration of human toxicity during the pesticide regulation. Every person is important, every in society. So during the introduction of any pesticides, analyzing of the human side effects, and if it is more toxic, highly toxic, and whichever the compound have no antidote, there should be like no introduction of that compound without antidote. That should be the criteria. But in paraquat, there no antidote and it is highly toxic. But since 50 to 60 years in India, it is going on and causing so many deaths, morbidity and mortality. So that any compound we want to introduce, it has to has less toxic, or it should not. I mean, it has to some antidote like organophosphorus poisoning. We have antidote like pralaxam and all. So we should have antidote. Then only we have to introduce. Otherwise, it will cause a major damage to the society. And stronger mechanism for reporting and monitoring pesticides poisonings, like from the manufacturer, from the distributor, pesticides shop holders, and agriculture officers, and farmers. To all these chain system has to monitor with QR code. So any farmers having the 1 acre, like 2 acre, so they require some amount of these pesticides. They should have to have only that much amount of this paraquat compound. Otherwise, it is used for the suicide or like that. They are misusing this compound. That chain system of reporting and monitoring system should be there, and evidence-based action to reduce death from these poisonings. So, like as I am nephrologist, We are treating this paraquat early in within 4 hours with hemo perfusion or hemoadsorption. But how many people will reach to hospital in 4 to 6 hours and they will accept for this special dialysis? So very rare. Even though we are treating with the special dialysis treatment, mortality is 85 to 90% in spite of treating. So this much toxic compound should be banned. So it is already banned in 74 countries, and those countries from banned countries we are getting and we are affecting in India. So that's why we are requesting central government and in many forms we given representation in national level as well in state for the banning of this compound. Not only this compound, so many pesticides have harmful effect, but we are dealing with panic. Next, please. Why paraquat requires special attention? Because it is highly toxic. It does not have any antidote and very high mortality with very small amount with like 5 to 10 ml consumption also leads to death. So it acutely affects the lung, liver, kidney. Eventually, within 3 to 7 days, mortality is inevitable. And we are discussing about the long-term exposure causes the Parkinson's, as everyone knows, more than 200 cases in USA regarding the one paraquat producing industry uh, by Parkinson's affected people. So recently, one state also banned in USA. And thyroid cancers also caused by this paraquat and hematological malignancies like leukemia and lymphoma. And more important, who young girls who are in agriculture field, they having the abnormal babies, challenged babies because of chronic exposure, and it also affecting the aquatic animals and thereby is giant system we are affecting and all other animals or aquatic animals also getting affected by these pesticides. So and I request Narasimha Reddy sir, I want to listen Narasimha Reddy sir's inputs for the uh, pesticide management bill. And with this, I thank everyone for giving opportunity, my DAPP members and also MAPP Maharashtra Pesticides Affected Persons Association and also Nature Coalition for Natural Farming. Thank you, everyone.
Thank you, Dr. Rakesh. Um, Uh, and with that, now I would like to invite Dr. Narasimha Reddy Garu to share about Pesticide Management Bill. Dr. Narasimha Reddy Garu is an advisor for the Maharashtra Association of Pesticide Poisoned Persons, and he's been working in the area of pesticides from over a number of years, even decades, on policy perspective from various aspects, and he's been involved with the larger development sector, even beyond pesticides in other themes as well. Narasimha Reddy Garu, over to you.
Thank you, Rohit, and also thank Dr. Rakesh and all of you for joining today. I hope the screen is visible, Rohit.
Yeah, it is, yes.
Yeah. Oh, thank you. Uh, I think we are going to discuss pesticide management bill per se. Uh, of course, there are a lot of other issues, dimensions, but today we thought no, we can discuss with doctors and the medical fraternity on what this bill means and this is basically an opportunity in the last 40 50 years. This is the first time we are getting an opportunity to know, relook at pesticide regulation in India. So I'll just go through many aspects which I think are important for all of you as medical fraternity. So at the outset, I would like to clear some of the myths which every one of us believe. Because many in India, including some of the farmers and of course medical personnel, believe that without pesticides we can't grow food. So I think that's wrong. And even today we are growing food without pesticides. And even before pesticides came in, we have been for thousands of years we have been growing food. So without pesticides, food cannot be grown is a myth, and I think we should get out of that thinking. So, but I am not going into all those other details. But basically, because whenever we discuss this, everyone thinks, okay, we don't have any way out. That's a kind of thinking. So I'm just at the outset trying to clear that. Now, coming to a pesticide management bill, this bill essentially,
Narasimha Garu, your
it-
slides aren't moving yet. If you move the
yeah,
slides.
yeah, I'm trying to
Okay,
move.
fine.
So, essentially, this word pesticide poisoning is not there in the pesticide management bill. So, I think we need to keep talking about these two words, which are very important. Now, many of the people keep asking why regulation. I think one is there is a widespread poisoning, and for the past 35 years, we have been documenting, pursuing a lot of poisoning. Then, because of pesticides, we are losing a lot of diversity, natural diversity, which feeds us and which also continues the environmental and ecological cycles. And in the last again 30, 40 years, because of pesticides, many insects and plants have developed resistance. So over and over, they are discovering new kind of pesticides basically to overcome this resistance. So this conflict is going on, and we are getting new and new kind of compounds that again many of the people are not aware. So pesticide is not just a static word; it is becoming more dangerous and hazardous. And of course, public health degradation, which most of you know, is very steep. And in many places today, we are looking at cancer rates which are increasing. I think recently government admitted that every day in India, 14,000 cancer cases are getting registered. And that too, many states, they don't have a register. Even then, that figure is very high. And once you look at the national register and every state comes into that register, it can be a mind-boggling figure which you are looking at. And if, the pesticides are ineffective. Most of the, almost 100% of them are ineffective in addressing the problem which they are saying is killing the pests. And ultimately, food poisoning is happening. As Dr. Rakesh mentioned, now we have residues in every food we are eating. So we are continuously, right from morning to evening, whatever we eat, you can see some traces in any of the those foods. I'll just go through some of the incidents because just to update you on why we are talking about pesticide poisoning. So there are these studies which are done, and they are saying 44% of the global population which is working in on farms is poisoned every year. So that is out of 860 million farmers, almost 45% are poisoned every year. So it's not just a Indian problem, it's all over the world. And the total fatalities, they are that steady. as recorded is 11,000 deaths per year, and out of 11,000, nearly 60% occur in India alone. So this is again a major revelation. And the United Nations study also did, and they documented every year all over the world 2 lakh deaths per year due to pesticides. And there are other studies which look at self-poisoning, so what we call as suicides due to pesticides. And again, that figure you can see is very, very high. Now, now there are incidents, uh, in 1958. In fact, the Insecticide Act 1968 was brought after this incident which happened in Kerala in 1958. So many people consumed, wheat which was basically coated with pesticide that was converted to flour, and many people ate that without knowing, and 64 people died in that, and that led to pressure for a pesticide regulation, and that's how in 1968, after 10 years after this incident, we got Insecticide Act. But then, if you look at Insecticide Act from 1968 and until now, it has still not, it has a framework which prevents such tragedies which are happening. So you can see in Kasargod, in Kerala again, endosulfan was sprayed extensively in 1980s. Aerial spraying was done, and almost 6,500 individuals were affected. Even today, endosulfan was banned in 2011, and even today the victims, their progeny, so the genotoxicity is apparent in those that area, Kasaragod. So even today we can see the victims. Then in 2017, we have documented cases in Tamil Nadu. And this one was very alarming. In Karnataka, a class 5, very small boy was used to pour pesticide into school water tank. And luckily, someone smelled the water, and then they stopped everyone from drinking. But still, 12 students were hospitalized. So, pesticide can be a weapon to settle scores, is what this incident indicates. And of course, anyone can just go buy and buy the pesticide today over the counter. Vidarbha, we have documented in 2017 Yavatmal cases, and even now we are seeing deaths happening in Vidarbha where cotton farming is very intensively done. In Bihar, 2013, 23 children died after contaminated midday meal. That cook, she got oil in a empty used pesticide used container, and the someone warned that it is smelling bad, the oil, cooking oil, but the cook went ahead. In fact, cook complained, but the school headmaster said, no, go ahead, nothing doing. The meal was cooked, and 23 children died after eating that contaminated food. Recently, last year we have seen two children died and in their home where they stored wheat, and they had this pesticide basically to ward away pests on the wheat stock at home. So children died after inhaling the fumes of that wheat stock at home. So the annual, basically now it is a big agrarian emergency. I'm just trying to bring you to that. It's across India, and it's hidden because we are not documenting, we are not looking at it. When in Yavatmal 2017, there were almost 1,800 farmers who got admitted to district hospital over a period of 1 month. And only one farmer leader who noticed that why all these people are coming. And only because of that person, this incident came out. So we are not sure how many such mass pesticide poisonings are happening across India. So the annual burden is very, very high. And our estimation says that the cost on the farmers and rural families is somewhere near 15,000 to 20,000 crore per year. So these are not isolated incidents. We see this as a systemic regulatory failure. Now, within this, again, there are invisible victims. So farmers are directly applying, and we think farmers are getting affected. So they could be affected acute, and there are a lot of chronic cases as well. We have several cases in Vidarbha area. But the invisible victims are the women workers. So women, they wash the clothes, of the husband or whoever, the male, and they get contaminated. They carry water to the fields to fill the pesticide spraying tank. They clean the equipment, and post harvest also they keep going into that field, even though some of the pesticides, they have a label which says you should not enter this area for 15 days, 1 month, or those kind of waiting periods. So it's called waiting period, but that waiting period is ignored. So women across India are affected directly because their husbands are using, or their male members are using pesticides. Children, again, we have number of cases where children have become victims of poisoning, accidental poisoning. As I mentioned, the how the two siblings died in Madhya Pradesh. So many cases, where accidentally children put pesticide in their mouth, or they used empty containers. In fact, there was a case in Karnool in Andhra Pradesh where the grandma brought fruits from the field, and she carried them in a empty pesticide cover. And her grandchildren who ate that, they died within 4 hours because the grandma was not aware that this empty pesticide cover is a pesticide cover, and that remnants contaminated the fruit. So with her own hands, she saw her grandchildren die. So there are many such cases. So water contamination is happening. Soil degradation is completely noticed. Biodiversity loss is there. So now lot of places, this chidia, sparrows, all these are vanishing. Bees are vanishing. Pollinators are vanishing. Frogs are vanishing. So there is a huge biodiversity loss, and which can be irreversible also. And of course, intergenerational health impacts. So we don't even see why this particular child is born with a, genetically manipulated body. So this linkage is never seen. And of course, consumers, most consumers are not aware of what is the level of residues is there in their food. Recently, China has rejected thrice our rice because they are saying it is contaminated. European Union for the past 10 years has several times they have rejected our food exports, citing pesticide contamination. We don't know what we are eating in India because there is no regulation, or there is no the Food Safety Standards Authority of India does not look at all those things. So that's where I'm saying why this matters for hospitals and clinical. It's a clinical problem as well. So pesticide poisoning is clearly not recognized simply because there is a huge gap in the at the clinical level. One, we identified is ordinary household pesticides are also causing a lot of deaths. So many times, patients come after painting is done at their home, or fumigation is done at their home, and there are deaths at home as well of children and also adults. So it's not only agricultural misuse or illiterate use, but also in the households we are seeing that kind of cases. So what we identified in the last 25, 30 years is we don't have any standardized criteria or code about pesticide poisoning. I have discussed, we had a lot of conferences, and this is becoming a major issue. In fact, in Yavatmal, we are seeing they don't even have a minimum diagnostic instruments. So they don't even know what level and what kind of antidote has to be given, what kind of treatment has to be given. And second is there's no national registry. So, like, we are talking about now vaccine adverse events. So, similarly, we don't have a systematic poisoning surveillance system, which is there in other countries. Even Sri Lanka has it. A lot of African countries have it, but India does not have it. So, this is where I feel doctors are the first data point. So, yeah, once the doctors and the medical fraternity starts recognizing this, I think we can start looking at how regulation can, look at reducing this kind of deaths and issues. So just I'm here comparing with the adverse events arising from immunization, AEFI, and pesticide poisoning. So you can see of course, even AEFI in India is at a preliminary stage, primary stage. So, but still, that's a system which is still on the in place. So there is a mandatory reporting pathway. In pesticide poisoning, we don't have any mandatory reporting. There is a defined diagnostic criteria. So there's no in pesticide we don't have. So there's no data aggregation. We don't have a poisoning register. So I think just to have an idea, where are we with regard to the diagnostic blind spot? Will let us compare with the AEFI. Uh, Now coming to the law, what is the law saying? So as I mentioned, Insecticide Act 1968 was brought, and over a period, I think for long period, the network or the bureaucracy or staffing was not done for at least 10 years. Only since 1980s, slowly this law was being implemented. So number of committees were convened in 1990s, because that's a period we started looking at suicides happening in India using pesticides. So in 1997, 98, 99, a lot of suicides, farmer suicide happened in Telangana, Warangal, and Guntur in Andhra Pradesh. This is where it began. And of course, it later went to Punjab, so and it became all India phenomenon. So there were a few committees which are looking at what are the issues with the pesticides, and mostly focused on spurious pesticides and not pesticides and their impact per se. So this residue and data gaps was named by the Joint Parliamentary Committee in 2006. And then there was some strengthening of the maximum residue level based registration at that time. But then it was also linked with the international data production and patenting system, TRIPS. So again, this suffered because there was dilution and companies were intent on protecting their data with regard to their particular product. I'll come to that later. Now, for the first time in 2008, based on all these reviews and committees, in 2008, a new pesticide management bill was proposed, and it was tabled in Rajya Sabha on October 2008. So we intervened at that time. At that time, we had a united Andhra Pradesh. So we, as on behalf of the farmers groups, and also we had a state government minister. So we all went to the parliament as a delegation and had discussions with the parliament members. And because we reviewed that bill and we found many gaps in that. So I have suggested number of amendments at that time. But there are three amendments which we said though at that time, and even today they are not being provisioned in the bill. Three things. One is we said accountability, basically liability for any pesticide poisoning. So like any product, the producer is liable for the adverse effect of that product. So we know that, like a car or even now vaccines or any other product. But in India, we don't have that. You have other countries have. So we said we need a accountability liability principle. Then we said price regulation because farmers were exploited, and three state government powers to be enhanced. So in 1968 Act, state government powers are very weak and enforceable at a level of only enforcement. They don't have any say in the registration or deregistration or ban. So as Dr. Rakesh mentioned, that particular section gives powers to state government to ban only for 60 days and further additional 30 days, maximum 90 days. Beyond that, it is the prerogative of the central government. So that's the reason many pesticides which are reviewed at the field level and toxicity, they are not getting banned simply because the power is in the central government. So we are saying that has to be with the state government, and compensation has to be inbuilt because, like in US, they get compensation if they die or if they get any illness due to the pesticide. So we are trying to build that also into the bill. So these are the four important amendments which we proposed in 2008. But they did not agree. The companies who did not want anything like that. So it became a stalemate. So that bill did not become a law. 2013, the government again proposed amendments. Again, these four important things were not there. So again, we stopped that. So just to give you an overview, this amendment journey began in 2008. Then there was a 2017 version. Then in 2020, it was again proposed. And in fact, this amendment was introduced in the parliament, but it did not get through because of opposition from both farmers groups and also the industry. So now, last December, government has proposed another new version of the bill, and they call it Pesticide Management Bill 2025. But then they named it, the document as 2020 bill. So this is simply because the bill was introduced in 2020 in the parliament. So this 2025 is only amendment to that. That means that they don't need to introduce it again. So it is already introduced, and any day government can pass it. Take it up for discussion and pass it. So this is danger of getting past is very, hanging like a Damocles sword on our head. So this is a short journey. Now coming to what are the regulatory failures, the root cause. Looking at the 1968 Act 1, it is very old, and it was brought when the Green Revolution was introduced, and it does not have this dynamic mechanism to cover modern chemicals. So from organochlorines, organophosphates, we went to neonicotinoids. Now they are talking of new kinds of molecules. So they are no longer calling it agrochemicals or anything. They are saying molecules. So they are creating new kinds of pesticides, and this framework which we have does not respond to that new kind of products. Enforcement is very weak. Most state governments do not have testing labs. Testing for pesticide residue, testing for pesticide is very expensive. We don't have laboratories. We don't have capacity for that. Then the inspectors are supposed to be appointed by the government, state government, and invariably they don't. They are not appointed. In many states, we don't find even one inspector. And so in some states like Telangana, Andhra Pradesh, Punjab, there are pesticide inspectors, but their number is very small. Now the latest issue is the digital traceability. Now, traceability is what has been asked earlier, how to trace from production to usage. I think that is where that's how we can monitor and see this pesticide can be regulated, but that is not there in the 1968 Act. And the banned pesticides, they are continuously in circulation. Most of you know Endrin. And even today, here and there, we hear about Endrin being used by the farmers. So there are many pesticides which are banned. I think at least 49, but some of them are available because the language of ban is also ambiguous. So even recently, they banned monocrotophos, but the language is so ambiguous that it can be used legally still. And then the registration committee, is completely of bureaucrats. Even though Ministry of Health is there on the Central Insecticide Board, but there are no doctors or no one from public health experts are not there. Toxicology experts are very rare. So we have only IAS officers or clerks or superintendents or people who are moved up in their promotion. So basically bureaucrats, not the multidisciplinary team which is required for regulating pesticides. No farmer is represented, no worker is represented, and we don't see any doctors there. And there's a lot of conflict of interest. Pesticide industry is regularly consulted for regulating them. So there is this conflict of interest is there. Scientific evidence, which is number of papers have been there, like paraquat, which Dr. Rakesh mentioned. There is a lot of evidence, but it is completely ignored. So there, as I mentioned, there is no poisoning surveillance system. Household pesticide use is completely unregulated. Informal workers, who come and spray or fumigate, these are completely unprotected. They don't get any protected, PPE kits, or they don't even have a knowledge of what kind of hazardous toxic pesticide they are using. And now recently we have found that digital sales are increasing and they are uncontrolled. So the regulatory gaps that reach, the doctors. One is the traceability, as I mentioned. So whenever you have a patient coming to you, there are now at least 358 pesticides which are registered in India. These are the active ingredients, but the formulations are much more. I think at least 500. So we there's no traceability, so we don't know which pesticide has caused this problem. And the farmers, they are illiterate. They can't even spell the market names. So leave alone active ingredients or the co-formulants which are there. And then there is no poisoning surveillance. We had one for suicide. If a suicide was a crime in Indian, criminal procedure code, but that was removed. Until that was there was a police outpost in each public hospital. So if anyone has ingested pesticide, that case has to be MLC, medico-legal cases were registered. But that was removed recently, and so now there is not even that basic surveillance is removed. So there is no data, no information, no surveillance. And clinical definitions are completely vague in this, 2025 bill. The poisoning is completely undefined. Risk is undefined. Active ingredient is undefined. So there is these issues with which are important for clinical definitions. And as I mentioned, workers are invisible in this, the bill completely. The women or the work, who are the people who are going to be affected, and they are completely invisible. So the what the 2025 bill promises is they want to replace 1968 Act. They want to create a new central pesticide board. Now we have a central insecticide board linked with a registration committee. But the new act says there will be a central pesticide board, and largely its function is to advise on. But the real power is with the registration committee, and this registration committee, constitution, when and where, is under the central government control. So there is no way you have a administrative, transparent accountability mechanism there. The first time they talk about digital databases, but this does not mean that they are going to increase the traceability. This digital database is to protect the patents or the trial data given by the companies. Not it is not about database being shared with the people or with the medical fraternity. But still, now they are talking about a digital database. Transparency provisions, they say they have enhanced, but not many provisions we can see where the data or the surveillance or accountability is inbuilt into the bill. So as I mentioned, Central Pesticide Board has no enforcement power. So that means the Central Insecticide Board now, which becomes a Central Pesticide Board, will be advisory only. Only registration committee operates independently, and that is again a completely bureaucratic process. So ordinary use pesticides are completely unregulated. Even in the new bill, they don't even talk about these kind of pesticides. So we proposed 54 specific amendments. In fact, it goes the bill itself is some 38 to 40 pages, and we have suggested almost 70 to 80 pages of amendments simply because the language, the wording is completely tuned to encourage pesticide usage, pesticide markets, and pesticide production. So we have given specific suggestions and added 19 new sections. So one, I think, the one section which we introduced is we need adverse events, surveillance model like AEFI. So that means the pesticide poisoning cases, whether it is accidental, occupational, inhalational, or self-poisoning, I think all these cases need to be surveilled, and we need to start collecting data so that there is a mandatory reporting is there and a standardized investigation is there. Many times, we are seeing poisoning cases, they simply mention it as poisoning, not even pesticide poisoning, or they mention as OP poisoning. Now, the OPs are used very less now. A lot of neonicotinoids are used, but still they mention it as OP poisoning. So there are many issues within this system. So we need a legal provision where we need to standardize this data feed and surveillance monitoring. So that we have proposed in the law. Then we have added, I have, as I mentioned, we added a number of sections, but I'm referring only to whatever is linked with the medical and health emergency arising out of pesticide poisoning. So one is the household pesticide deaths. I think that is still outside the enforcement machinery. So we brought this again into the pesticide management bill because ordinary cockroach pesticide or this rodenticides, acaricides. There are many pesticides which are used within the homes, within godowns. Like now the food godowns like Jopto or Zomato. These people also are using a lot of post-harvest pesticides. So the all these are not part of the regulation. So we said we need to bring this under ordinary use pesticide. So not agriculture use pesticide, but all other kinds of uses which need to be brought in. So their pest control licensing has to be brought in so that there is a again traceability. Re-entry protocols. As I mentioned, that two siblings who died in Madhya Pradesh, they did not know that they should not be sleeping there, or in some Chennai apartment, people died because they entered the home within 8 hours of fumigation. So the re-entry period protocols, I think that has to be defined, and we need to work on that more closely. Mandatory disclosure, because active ingredients, many people are not aware. The labeling, even though there is a label detailed leaflet, but many don't mention that also. So we need to talk about active ingredients, because that's how I know medical fraternity can bring some good treatment, or try to save the patient if those active ingredients are known, what kind of poisoning has happened. Now we are talking of a relief fund, victim relief fund, because many patients, no, they don't have money, and they end up in the public hospitals, which are already overcrowded. So the per patient attention the medical fraternity is not able to give. Here we have seen issues, in Yavatmal again, where suddenly there were 1,200 patients, and many were in the corridors, and they had a IV put on the grill of the windows. So these kind of issues are there. So we thought we need a fund, a victim relief fund and a corporate liability fund, which can pay for all these kind of poisoning and health management issues. So this again, we have been proposing that it was not there. So strict liability in US, they have liability, and that's how many people in US they got compensation for glyphosate related cancer, non-Hodgkin's leukemia or I think some other name. So they got it simply because there is a liability principle built into their law. Of course, recently, 4 days back, the Supreme Court said the states cannot do anything, only the EPA can do about it. But still, there is something liability, but in India, there is completely no liability. So the victims of pesticide poisoning today, they don't get anything. Even a road accident victim can get compensation, but pesticide poisoning, they don't get anything. And the victim is blamed for using the pesticide. So I think we need to reverse this process through the amendment in the law. So as I mentioned, invisible workers and invisible patients are also there. So the pesticide poisoning patients, earlier government has in Maharashtra, they at least promised that there will be separate awards for pesticide poisoning patients, especially in the agriculture season. So usually there is a flow between July, August, September, October. This is a period when a lot of pesticide poisoning happens, and farmers, their family members, they keep going to the clinics or RMPs or the public hospitals. But these people become invisible because there is no proper mandated surveillance system. So I think that we need to again insist upon. Now, what you can do, I think I'm coming to the closure level. One, document exposure carefully. I think, as I mentioned, the inpatient record generally does not contain the name of the pesticide, specific name of the pesticide. So there are issues, challenges. The doctor does not have time to record all that, and the patient may not be able to tell you what pesticide has been used because he might have been unconscious or not in a position to speak. But then the attendant who comes with that patient may not know at all. So there are gaps, but yet I think we need to clearly document which pesticide, what active ingredient, and what is the route of exposure. Because most often, people are not aware, especially at the treatment level, nurses, they are not aware that pesticides they can enter the body in many ways, not just through ingestion, not just through inhalation. So today, a lot of pesticides are designed and uh, produced so that they can enter the body in different ways, and that kind of awareness also needs to be brought. So basically, the documentation of pesticide poisoning has to be done very carefully, and we need to bring a formal system into this process. I have written in the last 13 years several letters to national health authorities asking for a standardized protocol for treating pesticide poisoning patients. In fact, many doctors told me this will be helpful because when the patient comes, once this protocol is given, I think it becomes easier for everyone in treating that patient. Report suspected clusters. Like, we know there are clusters of pesticide usage, like, cotton farming, they use a lot of pesticides. So, we have seen wherever cotton farming is done, like Raichur, Yavatmal, Akola, even Adilabad in Telangana, Guntur in Andhra Pradesh. So there are many places where this pesticide usage is very strong, and these It is known for pesticide poisoning. So these clusters need to be identified. So we are saying these hotspots need to be mentioned, or there has to be a framework where we monitor through these hotspots. Then domestic exposure, again, the women, the women belonging to that pesticide spraying member or the farmer, they get affected in different ways. And though that domestic exposure is completely ignored, I think that we need to bring into the regulatory system. And of course, as I mentioned, we need a relief fund, and people should know about that relief fund. So these are some of the things I thought I need to bring to your attention. There are many other aspects, as I mentioned, a lot of issues are there with regard to registration and how some of the registrations are not done properly, and review system. Everywhere around the world, there is a process of reviewing the registered pesticide, because at the time of registration, the company gives data about the safety and its efficacy. They give you biosafety data, efficacy data, and this is reviewed and then the registration is done. But then this is data rising out of controlled situations. But the experience in the field can be different. And many times it was proven what the data at the time of registration and what is the experience is completely different across the world. Even in US, that's the case. So like a paraquat, they never mentioned that it will cause Parkinson's disease. But then now we are seeing that cases all over the world. So these registered pesticides are to be periodically reviewed, and depending on the toxicity or the impacts and the hazard potential, they need to be phased out. So this is a process which has to be inbuilt into the pesticide, regulatory framework. But then that is not being done in the last four drafts which we are seeing. So there are many such issues which we have been facing. But basically, even the MRL, maximum residue level, the issue is in 1968 Act, we have this monitoring mechanism. They said at that time also the issue of safety came up. So the government has said we have this section where we'll continuously monitor pesticide residues. So we have an all India pesticide residue monitoring program. But again, it lacks funds, it lacks laboratories. So it is still there as a rudimentary effort. And within that, they have been doing residue studies in urban cities. So Trivandrum, Mumbai, Kolkata, Delhi, Hyderabad, they go to some vegetable markets, they pick up and then they do sampling and they say residues are there. So usually we find that on palak, spinach, and many other vegetables, it was found. So even this data, the parliament, the data given in parliament says every year they collect around 25,000 samples, and they say only 2% or 3% are contaminated with the residues. But even this data is not being released to the public because pesticide industry does not want people to know these residues which are there in their food. So this system needs to be strengthened, and we need to make it more transparent and more participatory so that people can know, understand, and eat food which is residue free. So they need a choice in taking food. which does not have a residue. So this again, this is part of transparency and also accountability. But again, pesticide management bill does not have. So the chronic exposure issues are still outside the ambit of the pesticide management bill. And as I mentioned, acute cases, they are not acknowledged at all. So there are a number of acute cases every year. In fact, we have seen, as I mentioned, that Karnool case, that grandma, when the children ate that fruit and they became ill immediately, they took them to primary health center. And there they said, take them to district hospital because they don't have any bare minimum treatment systems, but they don't have ambulance also. So it took almost 8 hours for this family to shift those children to district hospital 30 kilometers away. And eventually they died because of that delay. I think is again an issue. So the entire infrastructure, medical infrastructure, especially in the hotspots, pesticide hotspots, needs to be increased, or we need to reinforce whatever infrastructure is there. So I think there are such issues which still remain outside the pesticide management bill. So anyone who wants more information, I can share. You can write to me on this email, and of course we can discuss some of them now. But I can give you a more detailed information and documents if you want to know more. So thank you all for the patient listening. Rohit, I'll stop here and we can.
Sure. Thank you, Narsimha Garu, for the very detailed overview. I mean, in such a limited time, and there is still so much more to be covered, but you covered very broadly and deeply a whole lot of themes of importance for the medical fraternity related to pesticides and pesticide management bill in specific. Now, I would like to invite Dr. Mansa for her comments on the pesticide management bill. Dr. Mansa is an emergency physician. Dr. Mansa?
Yes, yes. Yeah, thank you, sir. Respected chairpersons, healthcare professionals, everyone who has joined today. It's a good talk. I would like to express my sincere gratitude to all the speakers, Dr. Rakesh sir, Dr. Narsimha Reddy sir. He has enlightened us. As an emergency physician, I have witnessed many acute poisoning cases till now, and we have saved many patients. But all of them, there are two types of poisoning: incidental and accidental poisoning. Incidental is they're knowing that they can the poisoning, they're knowing the effects. Accidental is they're eating the food that are consumed, that are sprayed by the pesticides. They're eating the animals who consume those pesticide sprayed food. So they are getting accidentally effect of pesticides. And one pesticide deserve here special attention today. It's a paraquat. As we all know, paraquat is one of the most toxic herbicides ever which we have seen, because it does not have any antidote. It can damage our lungs, kidneys, and liver. And the person who comes a day after taking the paraquat, or at least 6 hours after taking the paraquat, as a doctor, we are not able to save them. And we are losing many people here. We have started a group on paraquat poisoning. It's a DAPP, Doctors Against Paraquat Poisoning. And we are working since 7 years. We have met many policymakers, farmers, and we are trying to introduce to the farmers like healthy farming, organic farming. We are trying to tell them the natural ways of farming. Uh, Successfully in Telangana, we have banned the paraquat. It's an important public health milestone. And successfully we need to do in the other states also. And we have to focus in the future of the agriculture. We should not, we have to encourage the farmers to go on organic farming and all. Thank you, sir. Yeah.
Thank you. Thank you, Dr. Mansa. This is again a very, very critical issue for medical fraternity on of various types. I mean, we obviously often hear about some impacts a bit more, but I mean, ranging from dermatologists to ENT doctors to, I mean, diseases such as Alzheimer's,
Yeah,
even,
I like to add
yeah,
one more point over here.
please go
As
ahead.
of now, we are seeing the acute poisoning cases, like the incidental poisoning cases. Now we are witnessing. But imagine the future, how it is going to be. Later, we are going to witness the chronic effects of poisoning. Most of in the US also, there the studies are showing the people who are consuming or agriculture, people who are having background of agriculture as their occupation, they are landing into early Parkinsonism. And the disease which we get after 65 or 70, they are getting in the early 40s to 45 years. That's really very sad. And the person will become slow, brain will become slow. It will affect the dopaminergic neurons in the brain. And eventually person will go into land into Parkinsonism in the early 40s. That is a chronic effect of any pesticide. So that will be more
Thank you.
dangerous compared to the acute effect. Acute, at least we are treating. Chronic, when the person goes into Parkinsonism, we cannot treat the huge group of people who are doing the agriculture. Because agriculture is the main occupation in the villages in India. And imagine many people are getting Parkinsonism in the villages after 20 years. That is a very dangerous stage. We are going to land in a dangerous stage. If we cannot prevent now, future will be unimaginable. We cannot imagine the future, how it's going to be. I feel
Absolutely
like that.
correct.
Yes.
Correct. Absolutely correct, Dr. Mansa.
Yeah.
And yeah, I mean, there are the neurological, neurodegenerative diseases, I mean, respiratory diseases, endocrine diseases, I mean, diabetes, cardiovascular, intestinal diseases. I mean, for new babies, I mean, babies who are just born, they are having pesticide residues coming in from mother's milk. And I mean, so it's such a broad encompassing issue that pretty much nearly every segment of the medical fraternity needs to
It is a
have such kind of discussions.
yeah, it is a chain of systems. So we are spraying the
Correct.
pesticides. We are consuming it. We are affected. And animals consume the pesticides. They are getting affected. And we humans, we
Absolutely.
consume the animals. We eat chicken, we eat mutton and all. Already they had pesticide pesticide sprayed grass. So eventually we are consuming in the both ways. We are consuming vegetables and we are consuming the animals also. In both ways, we are getting affected by pesticide. Indirect
Correct.
way
Correct.
of poisoning. Indirect way of
Yeah.
poisoning, we are going to do.
Absolutely. So even as you mentioned, animals, veterinarians need to be concerned about pesticides.
Yeah.
There are so many pesticide suicides which happen, and we have seen in countries which have taken stricter pesticide regulation, decline in suicides take place as well. We need psychologists, psychiatrists. I mean, pretty much the entire segment of the medical fraternity is impacted in one way or the other, whether through acute or chronic impacts. And there are numerous studies which show all of these impacts, causations, and so on as well. What Dr. Rakesh was mentioning initially, that and Dr. Mansa also mentioned that there are pesticides like paraquat and other pesticides as well, which are registered without having any antidote. I mean, those registration processes need to be changed. The bill, when Nasim Gairu was mentioning that the bill went to the Parliamentary Standing Committee, the earlier version, the Parliamentary Standing Committee asked for a mandatory review of pesticides after every few years. I mean, that has not been incorporated in the bill draft version. There are a whole lot of triggers which should generate a review of pesticides. I mean, numerous pesticides which are banned in other countries, but are still being used in India. So a whole lot of issues which continue to persist in the draft bill, and this being just I think the first webinar, I'm hopeful that many other members from various subsections of the medical fraternity are able to take this within their segments, within their various associations and groups, and this continues to churn a discussion. I'll just stop the recording and then maybe we can have a few more comments and Q&A. Or maybe we can continue the recording and we can see if there are some things that are better off the public, and then we can switch off the recording. So I would just give me a second. I'll change the settings so that the participants are then able to unmute themselves as well. Um, just give me a second. So yeah, so I do see some questions already in chat, but I think rather than me taking, you already heard, 3, 4 people so far. Might be better to actually now uh, have the conversation for more participatory conversation so far. So I would invite maybe the people who have already raised questions in the chat, and then we can take those one by one. Aniket Jadhav ji, if you could uh, come, and I'll share, or we'll share obviously all the recording and the PPTs. I'm assuming all of you have registered already and would have received the link via registration. Um, Aniket Jadhav ji, if you could, if you're able to, if you're still there and able to unmute. If not, yeah, Aniket Jadhav ji, are you able to unmute yourself?
Hi, good evening, sir. Really sorry that I could connect. One of my clients had shared me this link, and I'm really happy that something of this sort has been taken up today. The most
Please do
important
share
thing,
your email ID in the chat, no? That
oh,
way
sure.
I'll be able to.
Yes, yes, sir. Yes, sir. The most important thing,
Please carry on.
yeah, yeah. To introduce about myself, I'm a practicing nutritionist based out of Nasik. The only thing I am concerned about is the use of pesticides and herbicides in today's vegetables and also into the poultry. That is again building up as a part and parcel of the poultry eating all those corn, all those things. The most important thing I would like to understand is what effect it does it have on the liver health of a human. If of course with all the esteemed participants and also the guest who can answer this question, I'll be very happy to get more idea about it. Thank you so much.
Thank you, Aniket ji. Uh, Narasimha Garu, Dr. Rakesh, would any of you want to take?
No?
Oh, that.
Yes,
Oh,
sir.
sorry. Okay, Rakesh.
Yeah, concerned about paraquat, it has the acute liver injury, and in long term also, if uh, in chronically it has also a cirrhotic effect also. Like that, all pesticides have effect on all organs, like genetic effects, and by inhalation they are affecting lungs. But in per se, in lungs, it is a chronic liver injury, and acutely, if they are consuming, they are raising in liver enzymes like SGOT, SGPT elevation, and acute hepatitis will be causing liver injury. And in chronically, but CLD risk, it is not proven, but again in chronic exposure we have evidence for the malignancies, Parkinson's, and this thing, and thyroid cancer, but for exact liver injury CLD we does not have any evidence for that.
Thank you.
Actually,
Thank you, Dr.
there
Rakesh.
are,
Yeah, Narasimha. Yeah,
sorry,
Narasimha.
there are some 85 herbicides which are registered in India. And upper pesticides, as I mentioned, there are more. But I think the root, which Dr. Aniket was mentioning, is about the maize, the corn, corn being raised, used after using insecticides and pesticides, and then that corn being given as feed for the chicken, and then the chicken from the chicken to the human beings. I think this is a pretty sure way of residues reaching our body. Now, maize, how it is being grown, is now a mind-boggling issue. In fact, until recently, we did not have one pest called fall armyworm, and it came from Africa, and it became a major issue for farmers. So, across the research institution, they have started recommending highly hazardous pesticides to be used on maize. But yeah, farmers, they don't use all of them. But I can tell you easily some 5 to 10 different kinds of pesticides are used. Additionally, we have been talking, Rohit and me. Maize is genetically modified maize is now being imported as feed, and I think more is going to come from US. So you have a combination of pesticide, herbicide, and genetically modified corn, which inherently has some active ingredient within the genetic structure. So I think once you do specific studies, I think we'll be able to understand whether it is affecting liver or the metabolism. I think directly it affects the metabolism and then reaches the liver, kidneys, and other issues. So I think we need to, but other thing I want to tell you is the glyphosate is now being increasingly used and it is reaching very widely. All for Indians also, even though India is very low usage of glyphosate, unlike US. And in US, there is a lot of documentation, number of studies are available. So it affects in different ways.
Thank you, Nasima Garu. And there are also, Anikiji, please do share your email ID in the chat as well. There are again a whole lot of and in rapidly increasing body of studies which do mention on the linkage of pesticides to non-alcoholic fatty liver disease, even alcoholic associated liver disease, liver cirrhosis, viral hepatitis, hepatocellular carcinoma. I mean, yeah, I mean, then there are more and more of such studies which keep coming as well. So definitely cause for worry. And what also Narsimha Garu was mentioning. So one is pesticides acting in isolation. That is what a whole lot of the regulation is also based on. But here we are actually having bioaccumulation and biomagnification of pesticides as well. So various pesticides acting in combination, and the tests that are done, I mean, the residue impacts that are also calculated, they are not actually taking these into account, and which obviously have much worse impact than if it were just a pesticide as well. Um, Thank you for the question, Aniket ji. Dr. Kirti, if you mentioned a few things in the chat, if you could go ahead next.
I think Suhasi is also raised the hand.
Yeah,
Yeah.
so maybe after Dr. Kirti, Suhas ji can go next.
Yeah. I was mentioning that please avail the cholinesterase levels kits at the PHC level so that we can differentiate between the OP poisoning and non-OP poisoning. Because if there is a depression in the cholinesterase levels, it is definitely OP poisoning and the management is very clear.
Yes, yeah, that's a method, but the ACH devices are not there in many hospitals.
Yeah, but we can rely on the pseudocholinesterase levels. Recently, we
Okay.
did a study on the serial evaluation of the pseudocholinesterase levels, which is very much helpful in deciding the antidotes like atropine and pralidoxime.
Okay.
Yes, madam. Actually, we had to request the government to introduce in the hubs. Now it is like Telangana diagnostic centers in every district. Like in every state, every district, they have a diagnostic centers, center hubs. It is by NHM, National Health Scheme. So we request government to introduce at least in that area. So it will be useful for the all total district level. And from PHC, they will get sample easily, and they will give report within 68 hours at least.
Yeah, and secondly, the availability of the known antidotes at the PHC level, we have to check it out. And this is very important, I think, because many times I'm visiting many primary health centers of the country, and half of them are not, the atropine and palm is not available, or either not available, or the person who is managing is not a MBBS doctor, so he's not having any courage to use the proper antidotes. He is giving only gastric lavage and sending the patient.
At least one physician should be available at mandal level. Then only this system will change, and also availability of the infrastructure and drugs.
Yeah, and we actually pursue the price of the pralidoxime. And previously it was very high, now it is actually low. So the village doctors are very properly using the pralidoxime, and they are managing very good OPP patients, and they are reducing the mortality rate. That's why I'm happy with the management of doctors who are trained how to manage the organophosphorus poisoning patients.
Yes,
And
madam.
Indian
Yeah.
Society of Critical Care Medicine, I am the part of the toxicology group. We are also preparing the guidelines. This time we are doing the separate workshops and the national level guidelines through Indian Society of Critical Care Medicine.
So maybe
Madam, we need to represent through the IMA or directly from your association to the health ministry, so that and now in health ministry, not like previous, they are responding to our mails also. So better we will mail and we'll get reply for that. Or otherwise, from your association, somebody has to meet and to introduce this. Like that, we are doing for Paraquat. Regularly, we are meeting the policymakers. Uh, so that would be better.
Yeah, surely. Thank you.
And maybe Dr. Keith, if I could request you to see if we could also hold a session like what we had today with the toxicology bodies as well.
Yeah.
That would be great. So maybe we can follow up on that.
I will be more than happy to talk on the OP poisoning. Anytime you tell me, I will.
Brilliant, brilliant. So maybe with the toxicology groups itself as well, if you could do that, and then maybe we can cover both on the OP poisoning and on the pesticide management bill itself, and why the engagement of the medical fraternity of
Yeah.
the toxicology group, toxicologist is quite important on that.
And I have published a book on organophosphorus poisoning. That is for the not only for the MD doctors, but for the PHC doctors also. Even the nurses and paraclinical person also understand how to manage. First responders for the poisoning are always village people, and I'm helping them to understand how to manage these people poisoning cases. And I have published in 2020, and since 5 years I have donated more than 300 books to the PHCs of the India,
Brilliant.
and helping the doctors actually, though they are BMS, BHMS, or MBBS.
This is brilliant. This is great to hear, Dr. Keith.
And it's a question answer book, means I get the phone calls from the doctors all over the country now. So I understand where they find the difficulty in managing the OP poisoning cases. That's why I have done it as a question answer kind of book of 64 questions in organophosphorus poisoning.
Brilliant, brilliant. It's great to hear.
Thank you.
Suhashi, would you like to go next?
Yeah, thanks. I'm a headlights activist, so I have a question whether it is possible to give some kind of guidelines for immediate first aid kind of treatment for cases like that old lady using a wrapper and the children not getting treatment for 8 hours. So can you people work on for such emergency first aid kind of handling till the proper treatment is available? This was for Dr. Mansanta madam, and maybe Kirti madam also can answer. My second concern was for Narsimha Rao Garu. He also mentioned glyphosate, and today's news is glyphosate has not been banned by Supreme Court. in some case today's newspaper mention. So I would like to suggest to the platform to have another separate session on glyphosate and pressurize for glyphosate banning in India. There are proved lots of cases in USA on glyphosate health impacts. Thank you.
Um, Narasimha Garu, Dr.
Yeah, yeah.
Rakesh.
Okay. I think that's what we were saying. A rural primary health center, the first stage where the rural victims of poisoning approach have seen either RMP or the primary health center, and almost all the primary health centers, they don't have any basic infrastructure to respond. So this is where we are saying we need a standard protocol. And I've seen in one primary health center in Maharashtra, in near Yavatmal. So there they have written on the board that is for like gastric lavage, but that's for ingestion. Basically, someone has taken the pesticide deliberately. But for accidental poisoning or inhalational poisoning, there is no standard. So that's where we are trying to now, asking the government to build a standard protocol which can percolate down to the primary health center. So there is a lot of work which needs to be done there. And I think that Dr. Kirti, she has written that book. I think it might have a lot of, you know, guidelines on how we can do it at that level. But that means we have to again either get it included in the bill, in the regulation, or we have to get it included in the medical, framework, health care management, especially public health care management. So I think both areas we need to work on. So what Dr. Kirti has been trying to do on her own, I think we need to reinforce that and help in getting that because I'm saying there are number of cases where timely attention would have helped in saving the lives, but many cases it is always delayed, and because of all these issues, there is a Yellur case. In Yellur, there were 8 cases in one primary health center. In in fact, they said it is a mysterious poisoning, and it took them almost 10 to 15 days to establish that is because of OP poisoning. And of course, the doctor, she was a lady and she was brilliant, so she could save 18 patients using, whatever minimum she could do within that primary health center. So I think when you capacitate the doctors and the staff at the primary health center, lives can be saved. And that we can begin with the hotspots, wherever many of these poisoning cases keep coming. I think we can begin there and then spread it across.
Yeah, just wanted to touch a bit on the question regarding banning a pesticide. And just from the experience of the last few decades of civil society, there have been bans which have worked out on endosulfan, and there are bans, being attempted for paraquat. I mean, there have been attempts made for glyphosate in the past as well. And these are very worthwhile, worthy attempts, given the harm being there from, I mean, these pesticides. Huge number of lives have been lost. The issue is that as one pesticide goes, there are numerous other pesticides, quite a few problematic pesticides. I mean, Narasimha Garu was earlier mentioning on the number of highly hazardous pesticides which are still out there. There have been a court case which has where attempts have also been made to tackle some of the pesticides as well. And again, just to repeat, all of these are worthy attempts. If we are able to get the regulation right in itself, I mean, this is an opportunity that we're getting after 50 years, as Nasimagaru was mentioning. If we are able to get the regulation right, then that in itself will take care that we will not have to work around on, banning one pesticide and something else comes up, like a whack-a-mole or a rakta beej, where, you take out one, but numerous other pop up in their place. The pesticide industry is obviously also working on uh, other pesticides as well. They are not sitting silent as we are speaking. So getting things right, getting the regulation right, ensuring that pesticides, for instance, which do not have an antidote, are not registered in the first place. That would actually prevent us from situation like what we are witnessing for paraquat, where all these people who are facing what they're facing, and for numerous other pesticides as well. And similarly, so many other things. If we are able to get the regulation right, which is where the importance of pesticide management bill, something like this coming after 50 years, is immense, and something that where more and more of us should put our efforts into getting this right, spreading the awareness, and putting our efforts behind this as well. With that, I think we have done for the questions, and I think we can end the call now. So thank you everybody for joining in and sharing your comments. And hopefully, this is just the beginning of the conversation on pesticide management bill with the medical fraternity, of many others to come. So again, requesting everybody in here in the Zoom meeting, or who see the recording later on, to try and also arrange for something like this with their associations and groups as well. Thank you, everyone.